Good afternoon, everybody. My name is Ana Soler, and I work here at the Civic Canopy with Hannah Nichols. I'm a director and a facilitator, and we are super excited to have this time with you all, and we're very excited about the topic of results-based accountability. I wanted to give you a little bit of background on the Canopy. Our vision is the many working as one for the good of all, and we basically are working and striving to promote the way that change happens in the community and driving transformational tools and techniques and processes. We were founded after recognizing that there were a lot of people doing a lot of great work, but we needed to break down those silos so that we could work together, and it would be necessary to solve complex problems and try to have a bigger impact. To do this work, we used the community learning model, which some of you were on our previous call, and that's basically the way we structure our process so that we can include, dialogue, act, and learn with all to have better results. Our three-part platform is on the screen now: building connections, building capacity, and building a movement. Building connections is something we're working toward through shared technology. Building capacity is through training and technical assistance, and we will be aiming to build the capacity of others by equipping them with knowledge, skills, and tools to successfully carry out whatever collaborative strategic event or planning that they are working on. And then finally, building a movement, and this is through advocacy and engagement, and it focuses on changing city, state, and federal policy and systems through engagement and mobilization. That's our three-part platform that we are currently building and hoping to put into place over the next year or so. As a reminder, our next pre-summit learning opportunity is October 27th, and it is on a very necessary topic: collaboration fatigue. Some of you may have heard this term, but I think we all feel it when there's just not enough time in the day, but yet there's another meeting where we sit around a table and try to figure things out and move things forward. And then, of course, we have our major summit coming up November 29th through December 1st. And this webinar is just kind of a taste of what we'll be diving into during that summit. Finally, I would love to introduce Hannah. She is our speaker today, and she is also part of the Canopy family, and she supports the Civic Canopy's early childhood efforts as early childhood coordinator, including the work of the Early Childhood Colorado Partnership, Eastside Unified, and other collaborative projects. So she's had a lot of practice putting this RBA into place. She has a keen interest in approaches that promote holistic health and well-being for children and families, and she's been working to implement RBA with the Early Childhood Colorado Partnership for 3 years now. So again, welcome. Thank you for taking your time today to be on this call, and I will pass it over to Hannah.
Thanks, Anna. So before we jump into everything, just a couple logistical things for the webinar. Since there's enough participants today, we'll keep everybody muted. It tends to get a little noisy with background noise and a little bit messy when we unmute everybody when there's a certain number of people. So we'll keep everybody muted, but feel free during anytime during the webinar to pop in with a question. There should be at the bottom of your kind of GoToWebinar dashboard a box to enter questions. So you can enter them at any time. I will do my best to answer questions as I go, but we'll definitely leave some time at the end for questions if I don't get to it during. And if there's any audio issues during, you can let us know and pop in, but hopefully all should be good. And we're recording this webinar as well, so if you miss anything during, you can pop back in the recording. We'll send a follow-up email in the next couple of days. So with that, I'll jump into kind of our desired outcomes for the day. So hopefully we want participants to leave understanding shared measurement as a key element of collaborative efforts. So many of you involved in collective impact efforts might already be aware of what shared measurement is. After you leave this webinar, hopefully understand the basic concepts of results-based accountability, or RBA. It's a very it's an approach that takes a long time to learn. So this is today going to be just a touch and just an overview, but lots more to dive into at the summit in November. And then hopefully you can leave today feeling confident and excited to attend some of the summit workshops connected to shared measurement. So, so that's another big outcome we hope for today. And want to also give a nod to Results Leadership Group. They are an organization that focuses on doing trainings and creating resources around RBA, and then they developed RBA. And so they have a lot of fantastic resources on their website, and so we'll make sure to share that and follow up items. So just to give a little background on kind of shared measurement and why it's important in collaborative efforts, I don't know about you guys, but these kinds of statements that you see on the screen sound pretty familiar in my work experience in the past, in my career, that problems in my community are so big and so complex that it's just too much to take on. Me as an individual or my little organization just can't make enough of a difference. And I hear a lot. I just want to do my best and make change in my small corner of the world and make things happen. I think a lot of us, you know, as Anna talked about with collaboration fatigue, with all the meetings we have to go to, all the collaborative efforts, sometimes it's just like, I just want to shut my door and try to make change. But intuitively, we all know that doing what we think might work well or doing what we think might work best isn't the way to get to results that we want to see when we're trying to influence large-scale social problems. And so even when we do get involved in collaborative efforts, we often end up wondering if we're really making a difference or if we're just howling at the moon. And this is a slide that our partners up in Larimer County use a lot when they talk about RBA. And collaboration is, you can collaborate, but you don't truly know if you're actually making a difference a lot of the time. So RBA and shared measurement approaches work to combat that and help us find accountability and data-driven kind of change that we're looking for. And it sounds like we might have just a couple people that are having issues logging in to the webinar, but are able to hear audio. So I hope, I'm not sure we can do anything from our end, but I hope maybe logging out and logging back in might help in that respect. Hopefully, if anybody else is having issues, let us know, and we'll try to get things situated. So shared measurement is one element of collective impact. It's a key ingredient to success in collective impact because, as we just talked about, trying to make a change and make difference, and bringing together many people to make a difference is great, but when you're not measuring progress towards your shared goals, it's hard to tell if you're actually making an impact. And with collaborative efforts, shared measurement is much more challenging than it might seem. I think many of us have experienced that in the past, especially when you bring a large social problem like raising children or positive youth development and have multiple contributors at the table. It's not as simple as it might seem. And so this is where RBA, results-based accountability, I'll refer to it as RBA going forward pretty much, is a certain approach to shared measurement, not an end-all and be-all by any means, but it is one approach that we have found success with in collaborative efforts at the Civic Canopy, and I know there are several throughout the state of Colorado, and it's an international following results-based accountability. They are all over the world. Many different projects, collaborations, efforts, social change movements have been working to implement RBA. And so I want to take a little poll and get a little feel for where people are at in their understanding of results-based accountability. I'm sure we might have people on the webinar who are across the spectrum of totally new and maybe actually implementing RBA in your organization or collaborative. So we're going to try a poll. Sometimes these go well and sometimes they don't. So I'm going to bring up the poll. And so the question will be how familiar you are with results-based accountability. So I've launched, and hopefully on your screen you see the poll. And you can click on whichever option is most relevant to you. And I'll give people just a few seconds to answer. Five, four, three, two, one. And hold on. I just have to close the poll. Here we go. So it looks like a very small percentage are very familiar in implementing it. 37% are somewhat familiar, have been maybe trained before, have heard of it. 32% are not very familiar, so have maybe heard of it but never been trained. And 25%, 26% are not familiar at all. This is your first exposure. So we do have the gamut today, so I'll do my best to get to everybody's needs. And as I said before, this is a very broad overview. We do full-day trainings, multi-day trainings for organizations to implement RBA in their organizations, and collaboratives it's an iterative, ongoing process. So, so much more to be learned at our summit and beyond about results-based accountability. Thanks to everybody for taking the poll. So as I said, RBA is a different approach to shared measurement, or a certain approach to shared measurement, and it's meant to be unique in that it starts with the end and works backwards to the means of how to affect change and use data-driven decision-making to do so. And it's designed to be common sense and non-jargony. I personally will say, or in my experience, it can get jargony very quickly. And so it's actually pretty challenging to keep it from getting jargony. So I'll talk a little bit about that in a few minutes about how to combat that and how to address that. And most of all, emphasizes the use of data to inform decisions, and in collaboratives using data ongoing to inform their decision-making processes. And so just to give you a very simple everyday example of how RBA can be lived out in everyday life is a leaking roof. And this is, and I should go back to the previous slide, results-based accountability is based on the book Trying Hard Is Not Good Enough by Mark Friedman. And so a lot of this stuff is pulled from that book as well. And that book is a great resource for learning about results-based accountability. I refer to it often, and we do have copies here at the Civic Canopy if anybody ever wants to check out a book and dive deeper into it. So this kind of everyday example of results-based accountability in everyday life is a leaking roof. So if you're in your home, your apartment, wherever you may dwell, you're experiencing a leaking roof, how can you tell? You might have water kind of on your walls. You might have inches of water on the floor. Hopefully your basement isn't completely flooded. But that's how you measure your experience. How can you tell if the roof is leaking? And then, of course, you have to measure how badly the roof is leaking. Is it just as simple, maybe there's water in one corner? Is it just dripping into a bucket? Or the sad outcome, do you have feet of water in your basement? And so you might put out a bucket and measure the number of inches after each rainstorm and see over time if that inches of water is going up. Obviously, that's not a trend we want to see, so you're going to have to figure out how to fix that. And your effort is to turn the curve. Turn the curve is a phrase used a lot in results-based accountability to move that data point in the direction in which you'd rather it to go. In this case, you want it to go down. You want those inches of water to go down. You don't want flooding in your house. And so you are going to have to investigate and figure out the story behind that baseline data that you have, which is this chart up in the right-hand corner. So since you're not okay with that forecast, you got to figure out how to fix that. And why might it be leaking? Is there a hole in your roof? Is your roof out of date? Has there just been so much water, rain falling, that it seeped up from underground? What is the story behind the data, and figure that out. And then you have to figure out who you can work with to actually fix the hole, fix whatever the problem is. You might have somebody, a neighbor who is well-versed in patching roofs. You might know somebody, you might have to hire an actual roofer to come fix your house, somebody to come investigate and support you. And you have to figure out what works. If duct tape does not work the first time and you continue to get inches of water in your basement, perhaps duct tape, as it usually is fixes everything, may not work in this case. So you might have to think of other materials like tar, other patching materials, or a whole new roof perhaps. And then you figure out your action plan and go from there. And then, of course, each time you have to say, is it fixed? I think we often see our work as ending once you've done that action plan or created that action plan. But if the problem isn't actually fixed, then you haven't affected the change you want to see. So if we patch up our roof and we're continuing to get water, assessing that story behind the baseline, you have to go through the process ongoing, over and over, to actually make sure that you are influencing change. And so that might be for children, for families, for youth, for homeless in your community, whatever that group is or that social problem you're trying to change. So results-based accountability really focuses on two different levels of accountability. And so it's really important to distinguish between these two levels as you work through RBA, because I know I've experienced getting a little bit jumbled in what type of accountability I'm focused on. So first is population accountability, which is accountability for whole populations, like all children of Colorado, all elders in Weld County, all families in Routt County, so large populations. Whereas performance accountability, the second one, is about the well-being of client populations. And I think client's one of those words that is thrown around a lot, I think, in the business world, and those of us maybe working in the public sphere, nonprofit sphere. It's a little bit of a weird word, but it's the best word I've found to use with RBA. But we're thinking about the programs, the people we serve. So that's the well-being of the clients you serve. So it might be children, it might be families, but it's likely not all the families in Colorado that you're actually directly serving. It could be a group of families through a certain program. So thinking about distinguishing between that large-scale population accountability and performance accountability of how you're looking at your own organizational or your own collaborative performance. So just to get some definitions out of the way, we'll talk about a little bit later about how important language is when it comes to results-based accountability. It's that jargon piece that gets in the way. So breaking down those levels of accountability, you see the ones that we just went through, population accountability on the left side here, and performance accountability. So breaking down population accountability, you're looking at results and indicators. So on the highest level, on the population level, you're concerned about whole populations. So a condition of well-being for children, adults, families, or communities. And so an example of a result might be children are born healthy, children are ready for school, we have safe communities, you have a clean environment, prosperous economy. An indicator is a measure that helps you quantify whether you're achieving that result or not. So for children being born healthy, an indicator of that might be the rate of low birth weight babies in your community. For children ready for school, it might be % of children ready at kindergarten entry, and so on. Then at the performance level, you're thinking about the measure of how your program, agency, or your collaborative is working, your service system. So that is where you ask the 3 questions of how much did we do, how well did we do it, and is anyone better off because of our program or the actions we are taking. Or our action plan. I say program, it could also be an action plan that a collaborative is putting together. So the important distinction here again is between the means and ends. Resulting indicators are about the ends, the outcomes that we want for children and families, communities, and strategies and performance measures are about the means to get there, so the way we actually get to those outcomes. So if you think about it, the performance measures here, the performance level accountability is what gets us to that population outcomes that we're looking for. So language. This is how I've seen RBA get jargony really fast and get, or different types of shared measurement get jargony really fast. And language is a key piece because often we're all using different terms for maybe the same thing or using the same term and meaning something different. So RBA is great in that it encourages you to use a common language in your collaborative, and I would encourage you, if you are part of a collaborative or organization that is often possibly experiencing this issue of running into using lots of different terms to mean the same thing, to go through an exercise to say, what do we really mean? What is the idea that we're actually getting to? So RBA does have a set of language and definitions that they use. We encourage people to use whatever terms make you most comfortable as long as there's consistency there. So for example, went through this exercise with a group, and they broke into groups and came up with 3 different terms that all meant the same thing. So the idea is that condition of well-being for children and families. Some people will say it's an outcome. That's probably the one I hear thrown around the most. In RBA, they use the word result. And for our purposes, in a lot of the groups we use RBA with, we use the RBA terminology because it's easiest and it's included in the book. It's easiest to just go back to. But goal might be another term that you use as well. So just thinking about whatever the terminology you're using, the consistency is the key. And always going back to the idea when there is confusion. So diving a little deeper into population level accountability, and I'll just flip through a couple pages here. So it's always tempting, I think. There's a lot of us who are very action-oriented in collaboratives. I think we all have seen there's people who are more action-oriented, people who want to talk through things, and different types of personalities at the table. Ultimately, you want every kind. But with population-level accountability, it's always tempting to go straight to what we think works because we might intuitively think it works, but that doesn't always get us to results. Even if we do see a good outcome or we know that that program works, if we don't know how we've got there, then really you're not successful. So you want to start with figuring out what your end result is. What do you want? Is it healthy community? Is it everybody in your community eating healthy food? Is it, there's different types of results that you can think about. But the most important piece is starting with the ends instead of starting with the means, and then focusing on the way to get there. I think we often start the opposite way, and so that's why I like results-based accountability. It encourages you to think about your outcomes first, and then finding the ways to get there. And the way to think about that is, what does success ultimately look like? And I've seen a lot of realists in groups get caught up in the all children born healthy. That's not ever possible. Okay, that's fair enough, but what if it is? So to think about, what's that blue sky success look like? Every person in your community has access to healthy food. That's not totally unattainable. So thinking about blue sky, what does that success look like? So just some examples of results in everyday life and used by different collaborative groups around the state. So these are 3 different groups that are using RBA in different ways, which is kind of cool. It's not a one-size-fits-all approach either, which I like. The Early Childhood Colorado Partnership, I work really closely with this group. They use 4 shared results that are also results shared through a statewide framework, which is really cool. All around different kind of areas of early childhood, around young children reaching their full potential, adults being knowledgeable, environments, and then getting to states and localities. Larimer County Early Childhood Council is implementing RBA for their council, and they have 1 shared result that all children are valued, healthy, and thriving. So it's a pretty broad result. Prowers County they have a group of collective impact team there in Prowers County working on healthy eating, active living in their community, and so they have results specific to Prowers County. So all Prowers County residents are physically active, eating healthy foods, and families are choosing to stay and live in Prowers County. So these are just examples of results that are being used in Colorado in collaborative efforts. And I should note that even though today we don't get to dive deeply into any of these, we dive deeper a little bit into Prowers County. There's just not enough time today, but we do have the right people to connect you with if you want to learn more about these groups and more tools and resources that we can share with you if you're interested in more. So that was a little overview of population level accountability, the short version. Getting to performance level accountability. Now this is taking that deeper level, not thinking about whole populations, but thinking about performance measures for, it could be your collaborative, it could be your organization, or a program. And I see a hand is raised. I don't know, it could be that somebody wanted to ask a question. So if you want to ask a question, there's a question box at the bottom of your dashboard, so feel free to jump in there and ask a question if you want to. So there's 3 different kinds of program performance measures, and you can see this grid is kind of cool. You can actually just enter things into a grid like this in a, if you were to practice this in your organization or effort. So on the left side here we have our effort and effect, and at the top is your quantity and quality of work. And so the top left is how much did we do? So that's actually the simplest question to answer. It could be the number of people that you served, the number of people involved in a program, the number of people or organizations who are listed as a partner for your collaborative. The quality might be how well did we do it, you might get feedback, the quantity of your effort, and then the bottom, the effect, is the toughest ones, the toughest piece to answer, and the most valuable information you want. Is anyone better off? So what number actually was changed by your program, your collaborative, the percentage change. And I'll show you with a little example that might make it a little clearer how this looks in just a second. Let's see if I can click over. So this is an example of a drug and alcohol treatment program. So in the first box, that's a simple number of persons treated. That is not a hard number generally for us to track. That's most grants. That's the first number the first thing you go to is enter just the number that you've delivered. So it's not the hardest to track. How well did we deliver it? Could be the percentage of your staff with training or certification in that type of treatment program. Now it gets a little harder. The number of clients off of alcohol and drugs when they've exited the program in a year after. You can track that for sure. It's a little bit tougher, and your grant report might require you to send a report in before then. So there's nuances and everything. And then the one in the bottom right-hand corner is really the one you want to get to, is percent of clients off of alcohol and drugs that exit and after 12 months down the road, 3 years down the road. Ideally, you want to see that long-term outcome. And it's true that this is definitely challenging to track, and funding cycles don't always meet those needs, but is it worth still figuring out what your outcomes are, and how can you track this kind of data? So this is the type of activity we would spend maybe you could spend a full day or half day going through with an organization or a collaborative to figure out what are the pieces of data you want to track in each of these different boxes. And over time, hopefully, you'll produce some data that will be meaningful. And another thing to really think about that we've seen groups get caught up on a lot, this is generally not covered in the kind of overview of results-based accountability, is thinking about who your clients are or who your service, who you're serving. In our world, it's hard to distinguish sometimes between your service delivery system and your clients, or those who you are serving. So if you are a program providing developmental screening for young children, for example. I go to early childhood examples all the time because that's where I live. But your service delivery system might be children and families in Colorado. Your service delivery system, your population level results might be around large groups of populations. But you're not physically serving every child in Colorado necessarily. most likely you're serving a smaller number. And so thinking about your clients, in early childhood council, for example, in Larimer County, I remember they said that at first they were thinking about children and families, all children and families in Larimer County being their service, their clients. In reality, child care providers were their clients, their primary clients. And so thinking about that and going through that exercise in your organization or your effort might be really important. For the Early Childhood Colorado Partnership, we were thinking about children and families as our clients, but it's actually the network, the Early Childhood Colorado Partnership Network, the members of the network that are the people we serve. So just thinking about that. And then thinking about where is there overlap and an opportunity to collaborate with others is another, that opens up a lot of doors. All right, so a little bit of practice. We want to see how, with that quick overview, how well you were doing at identifying a result, an indicator, or a performance level measure. And it might be a little tough since it's only been, 15, 20 minutes. But we're going to give it a shot anyway. So number of hours community partners contributed to council work. This is a real one. Is it result, indicator, or performance measure? Give everybody a couple seconds to think about it. That's a performance measure. So that's a specific early childhood council is tracking data on the numbers of hours community partners are contributing to their work, so their actual organization. Families are engaged as leaders. I clicked forward already, but families are engaged as leaders in their child's development and learning as a result. So that's a population level result. The percent of child care programs achieving and maintaining a 2 to 5 quality rating. Five, 4. That'd be an indicator. So that could be a county-wide. If you're, I believe that's a Larimer County indicator that I borrowed. That they're tracking, even though they might not be working with every child care program, that's still population level at their county. So it can be an indicator to get to this result possibly. And childhood obesity rates would be an indicator as well. So it takes practice. Check in the question. So is there a worksheet or tool to help plug in the numbers or goals? Yes, there are lots of tools that either we can share with you. That's a great question, Carla. Thanks for asking. So we can share a lot of tools with you guys, and we'll try to make sure we attach as many resources that we can to a follow-up email. If you're able to go to that Results Leadership Group website, you can Google them and it pops up. They have a lot of tools as well. So I encourage you to go there as well. Check on time. Okay, we're good to go. So turn the curve, as I talked about earlier, we basically went through a turn the curve activity with that leaking water example. So a turn the curve when it comes to more collaborative efforts and service delivery systems with populations, it can get a little bit more complicated, but I've experienced a lot of turn the curve activities in my time doing RBA, and it's really fun as well. It can get a little bit hard, but it can be really fun. So turn the curve thinking, just the way of actually thinking that way. We're going to use Prowers County as an example. So Bill Fulton and Megan Cheney in our office are working, the past couple of years had worked with Prowers County, a group who wanted to think about healthy eating, active living, and getting families to stay in Prowers County. And so got to go through the whole RBA process with them and identify different shared results and indicators. And so this is just an example of their actual RBA in real life. So this is their turn the curve activity. So they have their result at the top. One of their shared results was that families choose to live, stay, live, and invest in Prowers County because they had a lot of people moving in and out. It's very transient, people moving in and out of Prowers County. Lamar is the largest. That's the Prowers County's down in southeastern Colorado. Lamar is in Prowers County, to give people an idea geographically. The indicators they chose to measure were livability, net migration rates, so who's moving in and out of their county. So these indicators, this is choosing indicators for a large collaborative is not as simple as it might seem. I know we all are experienced, I know in the early childhood world for certain, data is tough to come by, and it's often only tracked every 3 years at a minimum in many cases, and so it's often hard to find the right data that you want. It's something that we continue to work on in the Early Childhood Collaborative Partnership, I know, finding the data indicators that we want, and then moving things to our data agenda, which is data that you don't have that you want, and so advocating for tracking that data, whether it be a state level indicator, county level, city, some municipality level data. So that's just kind of a nuance there and a little side note. So they talked then about, discuss where is the data with both of these indicators, went through their story behind the data, what partners are at the table, what works, and their action plan. So their story behind the data of this net migration, people moving in and out, was they had a plant that closed in 2000, 2006. They also had some people move in with a coal plant built in 2008, recession, all these different pieces, migrant workers from Listeria with the cantaloupe Listeria outbreak. There's technology issues, immigration plays an influence. So all these different factors are going into the fact that they have these different net migration rates, and these factors all play a huge role in them achieving their result of families choosing to stay in Prowers County. And so they dove deeper. At the heart of it, it's a challenging environment for business. You can see through this story behind the data that at the heart of that is it's a challenging environment for business. And so they came up with these possible issue strategies and things to focus on. So they need to rebrand Prowers County and make it a more appealing place to live in terms of just the branding, the education rates there. There's competition over wages, lots of different things. There's not a lot of affordable housing in Prowers County. So things to think about and consider. And then they came up with a list of strategies. And if anybody's worked with the Civic Canopy before, you know we love dots. So they did some dot voting, it looks like. So they came up with lists of strategies. And sometimes you can dive so deep in these strategies and say, oh, some of these are much easier to implement than others. So we like to do those kind of SWOT analysis of what are actually achievable, where is there super heavy lift and lots of investment, so like a neighborhood block party cleanup movie. So these are kind of community-oriented activities. Might be a less heavy lift than giving tax incentives to businesses. That's something that's a little heavier lift to get done. But where might be the biggest payoff is also things to think about. So you can see where this group kind of headed in their strategies and their action plan. And so that is really just the kind of RBA lived out in real life, an actual collaborative group that's implementing RBA and how they went through a turn the curve activity. And we can do, I know, just to give you an idea of how long a turn the curve activity takes, we've done it in an hour. It can take, you can do it multiple times and take a whole day and go with multiple results and multiple indicators. But a good activity to possibly go through with an organization. And if you get that book, Trying Hard is Not Good Enough, you can even do it yourself in your own organization. At this point, I want to pause and open it up for any questions. We wanted to make sure to allow ample time for any questions at the end. And I also included a list of resources that might be helpful for folks as you think about possibly doing this in your own organization. And Civic Canopy can always be a resource, whether it be trainings, just providing more resources, thoughts, and a lot of us in the Office of Experience implementing RBA firsthand. I think the biggest piece is that it's an ongoing iterative process. I know I've been doing it with the Early Childhood Collaborative Partnership for about 4 years almost, and it's an ongoing process. You have to ongoing check your data. Where is their movement? We only now just created performance measures for our network, and that's after 3 years. So just the nature of this is really takes a lot of thought, a lot of investment with time. Yeah, so Matthew asked if we can send the PowerPoint. We'll definitely tomorrow or early next week send a follow-up email to everybody with the PowerPoint, with the recording of this webinar that we'll be able to share with folks, and other resources as well. Any other questions, thoughts, feedback? We'll send an evaluation as well, so we want to get feedback on these webinars as well. Quiet. I think people need to get home to dinner. Is that what I'm guessing is the case? And I also want to make sure everybody is reminded and knows about the Collective Impact Summit. We're partnering with Tamarack Institute to host the summit. Is on set at the beginning on November 29th through the 1st, and registration is open, filling up, so make sure you register soon. It's going to be an awesome summit. There's some awesome workshops. We've been working really hard at the Civic Canopy to create a really awesome learning experience, and excited to learn with all of you. So you can learn more and see there's the speakers that are coming, different workshops that are popping up at the summit at our website. We have a summit webpage dedicated to location, all that stuff, amenities in Denver, and things that will be available. So with that, was there a question? I didn't see the question. And then, of course, the question box just disappeared. Question. So Megan asks, what makes RBA different from other strategic planning approaches, such as theory of change, logic models, evaluation plans, etc.? That's a great question, actually, and I think I wouldn't say it's mutually exclusive from any of those things. For sure, I think it's an approach that is very data driven. Is what I would say. What makes it really unique is that it encourages groups to track data continuously and to use that data to inform their progress and their action plans. I think a lot of the time we create logic models, for example, and don't really track how we're getting to the end, and if you do get to that end outcome, what actually contributed to achieving that. It's often not easy to tell. So that's the biggest difference, I would say. I don't know if anybody else has ideas or thoughts they would add to that. But I think it's a very intentional, ongoing approach. And it can be used at the organizational level and kind of large-scale collaborative level as well. Any more? I hope that answered your question, Megan. Cool. With that, we can let everybody get off, hopefully to dinner with family time and everything, get on the road. So thanks for joining us today. And again, we'll be following up in the next day or so, and we'll talk to you all soon.